Welcome to Your Family's Health, the program that focuses on healthcare issues with unique and different modalities for taking charge of your health today. Experts talk weekly with our continuing roster of guests from around the country and right here in Nassau County to keep you up to date on the latest health issues and trends. Take care of your mind, body, and soul. Spend the next half hour with the voice of Nassau Community College, 90.3 WHPC, and get on the journey to better health.
Hello and welcome to Your Family's Health. My name is Dr. Jeanine Cook-Garard from the nursing department here at Nassau Community College. And today we're going to talk about a very hot topic right now, and that is COVID-19 vaccine boosters and more. My guest today is Dr. Diego Hijano, a pediatric infectious disease specialist with St. Jude's Children's Research Hospital in Memphis, Tennessee. Dr. Hijano, welcome to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. Welcome.
Thank you for having me.
So first of all, we have to ask you the question, how has this virus affected you personally?
It has been, almost 2 years since we started planning of the virus reaching the U.S. It has been quite a journey. So on a personal level, obviously, I live here in the U.S., but I'm originally from Argentina. So I haven't seen any of my family members since the pandemic started. They haven't been able to visit us or we visit them over there. So obviously the isolation has been even harder as we have had all these ups and downs of no gatherings. So personally it has been difficult. And then professionally it has been so stressful and exhausting, but also rewarding. As many of infectious disease specialists around the country, we have to take on kind of this additional job on top of what we were usually doing to mitigate COVID-19 in our institutions, help individuals navigate COVID-19 symptoms, isolation, then vaccination. So certainly it has been a very rewarding process, but definitely very, very tiresome for sure.
So tell us about yourself. What was your career path and what made you want to become an infectious disease expert with St. Jude's?
That's a great question. Thank you. So as I say, I'm originally from Argentina, and I decided I wanted to be a physician when I was in high school. Conversation with my mom on what she saw me as doing in terms of helping people. And certainly my dad was a lawyer and my siblings are lawyers. So I was able to break out with the family tradition, and I'm happy I did that because I couldn't be a lawyer. And once I entered med school, I really fall in love with microbiology and like seeing these bacteria and these viruses causing all these problems. And I knew I wanted to be an infectious disease physician. And then the very last subject I took in med school was pediatrics. And I just couldn't see myself doing anything other than just seeing children talking with their parents, their grandparents, and just having that family-centered care. So I combined and I said, I want to be a pediatric infectious disease specialist. And I had the great opportunity of coming to the U.S. In 2011 to advance my knowledge in Nashville at Vanderbilt University, did all my exams to be able to practice medicine here and apply for a fellowship to do infectious diseases. And they called me at St. Jude for an interview, and I really obviously was not going to pass on the opportunity to visit St. Jude personally. For me in Argentina, it was always such an important place. And it just worked out really well because for me, it was a perfect fit, and they saw the same thing because they offered me the position. And I've been here at St. Jude since 2014.
So tell me, how many COVID cases with children have you seen at St. Jude's Hospital?
Oh, the last 2 years, we have had over 200 cases for sure. The thing to consider is that a lot of our patients that are high risk for COVID-19 because they have cancer are already pretty much isolated and protected even before COVID. They all wear masks, their family members wear masks, they don't go into big indoor gatherings because they are at risk of other infections. So even before COVID, they were very protected. And on top of that, we definitely had a lot of efforts within the institution to mitigate COVID-19 to keep our patients safe.
So what is the population of patients you treat at St. Jude's?
I'd say the two or three big groups we have at St. Jude's. So certainly cancer patients is what we are very well known for. So we treat hematological cancers like blood cancer, like leukemias, but also solid tumors. But we also have a huge sickle cell disease program. So patients with sickle cell disease come to St. Jude. And we also have an HIV program because, St. Jude mission, it's about no kids should die of catastrophic diseases. So while cancer is one of the most common and well-known catastrophic diseases, we take on others like sickle cell disease and HIV.
So at St. Jude's Children's Hospital, tell me about the vaccines. What is your recommendation for children with vaccinations for COVID? What age? And tell me why is it that there is a recommendation for children to get the COVID vaccine?
Yeah, that's a great question. So, since vaccines became available in December of last year, we have been recommending all of our employees to get vaccinated to protect themselves, their loved ones, but also to protect our patients and caregivers. And as vaccines became available for children less than 18 years of age, we have been recommending the vaccination for all of our patients. So currently, we have vaccines available for anyone above 5 years of age. So any patient coming to St. Jude will have a discussion with their nurses and their practice providers and their physicians about the benefits of getting vaccinated. In general, I think every kid should get vaccinated because the side effects of the vaccines are minimal and go up within 1 or 2 days, and the benefits of protection stay. So it will protect them against getting COVID, having complications due to COVID, and it will also allow them to start returning to a normal life, like going to school eventually without masks and feeling reassured that they are protected.
So which vaccine do you recommend for children to get if they are preparing to get the COVID vaccination? Is it the Pfizer, is it Moderna, or does it matter?
So the only vaccine available for children 5 to 18 years of age, it's currently in the U.S. is Pfizer. And what everyone needs to remember is that for everyone who is 12 to 18 years of age, we use the same dose as we use for adults, which is 30 micrograms of the vaccine. But then for children who are 5 to 11 years of age, the dose is decreased to a third. So we actually use 10 micrograms. But the vaccine, it's the same. So everyone looking at vaccinating their children, they should focus on Pfizer and the information related to the safety, efficacy of that vaccine.
So what makes Pfizer vaccine more appropriate for this age group than the Moderna or the Johnson & Johnson?
Right. That's a great question. It's not that it's more appropriate. It's just that it's the only one that has been authorized by the FDA to be used in this group. We know that Moderna have submitted all the information for get their vaccine authorized for those children 12 to 17 years of age, but that has not happened yet. Certainly, Moderna is also doing studies in those less than 12 years of age, as well as Johnson & Johnson. It's just that Pfizer, it's a little bit ahead of the others in terms of getting the studies done, the data collected, and then the authorization by the FDA.
You're listening to Your Family's Health on the voice of Nassau Community College 90.3 WHPC. My name is Dr. Jeanine Cook-Garard, and today we're learning about the COVID-19 vaccine booster and more. My guest today is Dr. Diego Hijano, an infectious disease specialist with St. Jude's Children's Research Hospital in Memphis, Tennessee. So, Dr. Hijano, could you tell me how do children compare with adults in terms of their immunity to the COVID vaccine, the COVID disease or virus, as compared to other populations? So the older adults, I know they're very vulnerable. Are children just as vulnerable?
Yeah, that's a great question. Obviously, we've learned that COVID-19 can be severe in our children. So certainly the risk of getting to the hospital and having severe disease and complications is lower in children than in adults. But it's not zero and it's not minimal. And this is what I think we have to emphasize, because parents are under the impression of that when very, very early on we were talking about the pandemic, that kids were not affected. And that has changed. During the Delta surge, we saw a lot of kids going to the hospital, even healthy kids. So it's not about kids with complications or comorbidities. So even healthy kids would get hospitalized, need to go to intensive care unit, have a tube put in to assist them to breathe. And we have over 700 children that have died of COVID-19 in the U.S. alone. So, when we look at that group age from 5 to 11 years of age, COVID-19 is the 7th leading cause of death in that group in the U.S. So certainly we need to start kind of going back, and not to be an alarmist, because it's true that COVID-19 is less severe in children, but it's not minimal. And I think the importance of the vaccine is that the side effects are really not concerning, and then you can prevent all of these deaths that are happening in children because of this virus.
So we know about the Pfizer vaccines that are recommended for children. What are your thoughts about the booster? So in addition to the Pfizer 2 shots, the immunization, you're also recommending the booster for the children as well, similar to adults?
So the booster has not been approved or authorized for anyone less than 16 years of age. So as of this point, when we talk about boosters, which is getting an additional dose of the vaccine because your immunity is kind of decreasing over time, it's available for those who are above 16 years of age with Pfizer, and for those who are above 18 years of age for Pfizer, Moderna, or Johnson & Johnson. So at this point, anyone who is less than 16 years of age does not have, there is no authorization or approval for them to get a booster. But certainly those studies are being done, and eventually we may have more information on how to proceed in those groups.
So should parents of teenagers make sure they get that third shot sooner or later? Is there a gap of space, a protocol for getting that booster?
Yeah, so anyone who has a teen at home that is 16 years of age or older, certainly would take them to get their booster. It has to be at least 6 months after they receive their second dose. But it's especially important, coming holiday season, as we are all gathering together and traveling, which we know increases the risk of COVID-19. But also we've learned from South Africa and other countries who are experiencing a surge of COVID-19 due to the new variant Omicron, that actually boosters makes a big difference in protecting us against that new variant.
Yes, that's very true. I heard the same thing. What is the latest guidance on getting the vaccine if you've had the COVID virus?
Oh, that's such a great question. This has been very, very hard to address. I think it's important to first acknowledge that it's true that when you have the infection, when you have COVID-19, you generate some protection. And reinfection, like getting the virus again, is very rare early on. But the two main problems that we see is that, first, not everyone that has an infection actually mount an immune response. So it could be that one individual with COVID-19 has really, really good protection versus one individual may not have any protection at all. Unlike with the vaccine, that protection kind of decreases over time. So what we need to think is what are the benefits of individuals who had COVID-19 of getting vaccinated? And they are formidable. So individuals who had the infection and then get the vaccine develop what we call hybrid immunity. which is the best immunity you can get against COVID-19 and any new emerging variants. So when I talk to my patients or my parents or employees that they say, I have COVID, I don't want to get the vaccine, why do I need it? I was like, it's not so much that you need it early on, because we know that for a few months, the reinfection is rare, but it can happen later on. And what are the benefits? And if you get vaccinated, then you become sort of bulletproof against COVID-19.
So I know some anti-vaxxers, people who just refuse, right, to get the vaccine. They claim that natural immunity is good enough. Do you agree with that?
It really is not, and we have certainly studies to show that. So when we compare the antibodies that are generated after infection versus those with the vaccine, the ones with the vaccine are better. And in part is because it's a more controlled immune response, so everyone gets the same dose of the vaccine and everyone mounts an immune response. With the infection, as I say, varies significantly. Individuals who do not have symptoms or who have very mild COVID-19 may not develop antibodies. And then the other thing is that even if you develop antibodies, they will decrease over time. So it's a perfect opportunity. If you had COVID and you recover, get the vaccine, because that will take you to another level of protection.
So what do you say about these anti-vaxxers who may live with you? Say maybe, for example, I have the vaccine and maybe my husband doesn't have the vaccine. How should I now treat him coming in from maybe the outside and being amongst the population of people? Do I separate myself from them so that I'm not getting, he's not immune and I am? How does that work?
I think the most important thing is first, in terms of taking a step back and say, what are the concerns and why that individual is not getting vaccinated? We have new data coming in that a year after starting vaccination in the US, vaccines have prevented over 1 million deaths, over 10 million hospitalizations, and over 35 million infections. So certainly, we could have prevented all of them if everyone would be vaccinated, but at least with what we have done so far in this year, vaccines really work. And with almost 800 people dying of COVID and less than 5 really linked deaths from the vaccine, one should talk to these individuals and say, what are your concerns? And try to address them, try to point them to the right information. Because I think many of these individuals who are not vaccinated at this point are still struggling to get the right information. Mm-hmm. Now, once you kind of go through and you can discuss that, how do you manage on a day-by-day basis? I think, if you are in the household, it's very hard because we know that you can transmit the virus even 2 days before you start developing symptoms. So sometimes, when somebody in the house develops symptoms, you have already been interacting with them for a few days, and you separately cannot split within the home if they are unvaccinated. So certainly it becomes very challenging. I think that when you have individuals from another household trying to come for a party or a gathering, that's a little bit easier, because then you can ask those individuals to make sure that they don't have any symptoms or exposure in the past 2 weeks. And then if they don't, they can come to the house and attend the event. Some families are also kind of doing these, home test kits before the event. It has been done in weddings. And so where you could ask somebody to say, okay, we are all getting tested before the Christmas.
How accurate are those kits? Are those kits very accurate?
They are pretty good. Certainly, it's not what we prefer to use as compared to PCR testing. But as you think of the practical things of attending an event and being safe, certainly, no symptoms, no exposure, and a negative test, if it is well done, is reassuring that at least the event is going to be safer.
You're listening to Your Family's Health on the voice of Nassau Community College 90.3 WHPC. My name is Dr. Jeanine Cook-Garard, and today we're learning about the COVID-19 vaccine boosters and more. My guest today is Dr. Diego Hijano, infectious disease specialist with St. Jude's Children's Research Hospital in Memphis, Tennessee. So, Dr. Hijano, this really does lead me to the next question. There are a lot of misinformation about vaccines. So I want you to clear up some of these rumors, if you will. Do COVID vaccines cause infertility problems?
No, they do not. I think that has been one of the main barriers that we have struggled to. So, we should make sure that we understand. First, there has never been a vaccine linked with infertility. And this is not new to COVID-19 vaccines. With other vaccines that have appeared over the last 10 years or so, the anti-vaccine movement has also kind of played this role of trying to say that the vaccines cause infertility. And why? Because, infertility is a very sensible topic. Yeah. It's common. We know that it's a common problem for many families in the US, and we really are able to grab the attention, engage of individuals, and then paralyze them in fear of not proceeding with vaccination because of the what if, right, that can cause. But one should remember that first, every myth that has been come related to infertility has been proven wrong. So the first one was that, the antibodies that you generate against the spike protein from the vaccines will attack the placenta. That has been proven to be wrong. There is a study showing that women who had antibodies against the spike protein, either because they recovered from COVID or they had the vaccine, did not have any problems in developing a pregnancy. We have seen a woman getting pregnant through the trials. And, the vaccine really mimics what the infection does. So if the vaccine would cause infertility through that mechanism, then everyone who had COVID would also be infertile. And that has not happened. So when that kind of was debunked, the second thing was like, well, these vaccines, mRNA vaccines, accumulate in the ovaries. And that cause infertility. And then we look at the studies that had been done before the vaccines were approved, because you need to do these distribution studies to see where the vaccine goes. And we know that really it accumulates where it's injected, and then mostly in the liver. And then in 48 hours, it disappears. There are no vaccine or vaccine products in the ovaries. So these things have been progressing over time. As we debunk one, there is another coming in. If you look at the components of the vaccine individually, those are very well-known components like fatty acids and sugars and salts that we use it on other products, and they don't cause infertility. So it's very hard because the what if is paralyzing for parents and individuals, but there is no evidence, and every body of science recommends vaccination and said there is no link to infertility.
So my favorite rumor is, does the COVID vaccine contain any microchips?
Right. Yeah, I think that's also has been one of the
Is
problems.
Bill Gates tracking us in some way?
Right. And even if they had a microchip, it's impossible to have that small of a chip through the needle.
Through the needle.
So that's evidently right. So certainly that's not true. And we vaccinated worldwide over 8 billion individuals, 8 billion, just in the US over 400 million. So these things would not be settled. So there is no plausibility for the vaccines to have a chip in their suspension. And
there's no way you can get that through the syringe, right? No way you can get that.
Yes.
I have another rumor that you can clear up. Yeah. Does the vaccine contain or can alter in some way someone's DNA?
Right. That's a great question. When we hear about mRNA vaccines, we get all worked up and we don't know what to make. And some people say, well, this is new. So first, let's remember that the mRNA technology is new. So since early 2000, BioNTech and Moderna, the two companies that have the mRNA vaccine, have been working on mRNA vaccines for influenza and other viruses. So this is not a new thing. And then what we know is that this mRNA does not get in contact with our DNA at any point. So it will get into the cell, but be degraded without touching the DNA. There is never, ever, ever an interaction between the vaccine and our DNA. So there is no plausible mechanism for the vaccines to actually alter the DNA.
All right. So now let's come out of the rumors and let's get another question that I think most people have. Can I have the COVID vaccine with the flu influenza shot?
Yes, absolutely. You can have the flu shot and the COVID-19 vaccine and any other shot that you are due for. There is really good evidence from studies showing that when you do the flu vaccine and the COVID vaccine, they are both safe and effective in providing a protection. So certainly don't miss the opportunity. If you are due for both vaccines, you can get your booster and your flu shot at the same time.
So are usually patients very sick after they get both flu shot and the immune?
Not really. Yeah, people think that there is going to be like an additional of side effects because you are doing both together, but it really not. You will have obviously sore arms because you give it one in each arm for 1 day, but then in terms of the side effects, it will not be worse by getting both together.
So with the booster for the COVID booster, are we doing that every 6 months, or is just 6 months from the actual COVID immunization?
It's actually 6 months from the last dose of COVID vaccine. So if you got Moderna or Pfizer, which is a 2-dose regimen, it will be 6 months after the second dose. And then for Johnson & Johnson, it's 2 months after your single dose of Johnson & Johnson. And at this point, that's the only one that is being authorized. We still don't know what's going to happen in the future. I think it's important for everyone to understand that this has been always a moving situation. A lot of us think that the third dose will probably be sufficient for boosting that immune response for a longer period of time. But the problem is that because we have a lot of vaccine hesitancy in countries like the US, where vaccines are available, but people do not want to get vaccinated, and then you have a lot of countries who want to get vaccinated but don't have the vaccines. This kind of is the perfect scenario for the virus to keep mutating and changing. And as new variants emerge, then this may be more and more difficult to control.
So after the COVID vaccine, if a person starts feeling side effects, how are they to know whether or not this is directly related to the COVID vaccine, or is this something new that's arising that is really, really harmful to their health?
Yeah, that's a great question. So we know that for those who get a COVID vaccine, the most common side effects are local pain, swelling, and redness where you got the shot, and that usually goes away within 48 to 72 hours. Some people will experience fever, body aches, and chills, but then again, they resolve within 2 or 3 days. Now, the shot will never give you respiratory symptoms. So if you have cough, stuffy nose, or problems breathing, that's not typically related to the vaccine. And if your symptoms are there for a week or longer, then that's definitely something you want to talk to your healthcare provider, because we know that most symptoms associated with the vaccine will disappear within 72 hours.
So if a person is having headaches, for example, or maybe feeling dizziness, that's irrelevant to the vaccine at all. You should not associate that with the vaccine.
So people can get headaches. What certainly we have been very clear to say is that it will not cause cough, breathing problems, or runny nose, because those are actually symptoms of COVID. And that's what people want to know. Should I get tested or not if I have these symptoms after the vaccine? So, fever, headaches, body aches, chills, fatigue, we've seen that with the vaccine. But respiratory symptoms is what should be a red flag for many.
So thank you for being here today, Dr. Diego Hijano, a pediatric infectious disease specialist at St. Jude Research Hospital in Memphis, Tennessee. We hope you stay safe and continue to stay healthy. And thank you for being our guest today.
Thank you so much for having me.
This is Dr. Jeanine Cook-Garard from the nursing department here at Nassau Community College. And we want to thank you for listening to this week's edition of Your Family's Health.
We'd like to get your feedback on your family's health. Send your comments by emailing them to whpc@ncc.edu. Podcasts of today's show are available on iTunes, Android Podcasts, and Spreaker. This program was produced at the studios of Nassau Community College in cooperation with the Nursing Department. Join us next week for another edition of Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.